Hello, everyone, and welcome to the COVID safety tip training for massage therapists, body workers, spa and salon practitioners, cosmetologists, estheticians, hairdressers, and any type of personal care service provider that's providing a personal service during the pandemic. We have a few safety tips to offer you over the next hour to try and keep yourself safe, your coworkers, and those that you love while you're working if you need to work during the pandemic. This course is brought to you by CE Institute. My name is Selena Belisle. I'm the founder and one of the approved CE providers teaching class. We usually teach in-person class. We've spent the past half year converting over 20 years of practice and training materials into online learning. We have many different live interactive hands-on webinars available at the school for CE credit for many different boards right now. This training, the free COVID safety tip training, is not a CE credit class, but it is free and it might help better protect yourself, your clients, and again, your loved ones. We are going to break down how to protect yourself in 5 different categories. But before I go through those 5 different categories, I want to share the safest way to protect yourself during the COVID-19 pandemic is to self-isolate. Okay, but for those of you who must work and live in the world of reality of mortgages and car payments and you need your mental sanity, there are some things to do to protect yourself if you are going to work, which puts you at risk. It puts everyone at risk when we are having that close personal contact. So the 5 different ways that we're going to review today in the next hour of how to better protect yourself includes how to improve your air quality. And how to, the second way will be practicing dedensification. The third way we're going to ask you to protect yourself is to reduce your exposure at work. It's a big one. The next and the fourth way we're going to ask you to protect yourself is to increase sanitation practices, and we'll review those in detail. And then we have a general practices category of different things you can do to protect yourself and others at work. One of the things that we'll start with today is your air filtration, air ventilation, and airflow. Before I go on to that, I'll just show you, this is CE Institute. And if you're interested in taking our CE credit classes, again, they're here in our webinar section online. For today's training, we're going to go through articles that I have written and had published by probably at least 5 different publications over the past year, and how our students can better protect themselves. You are our customers, and while we have been able to convert our education to online training, our students are not so fortunate. You cannot massage somebody through the computer. You cannot blow dry their hair, or color hair, or provide waxing service through a computer. So many of us who need to work have to have that close personal contact. So let's figure out what we can do at work to better protect yourself. One of the articles that we had published in October of 2020 was a Spa Safety 101 article. This applies to spa, massage therapists, body workers, cosmetologists, and so forth. In this article, we gave 3 different categories to protect themselves, for providers just like you to protect yourself. And the first one I want to talk about is air quality. In air quality, Massage Magazine actually published an article that is in much greater detail. It was 3 key factors in reducing the risk of COVID-19 acquisition and transmission. And we're going to address that by having practitioners, any therapist, massage therapists, and so forth, having you change your air, improve your air quality in your personal workspace. Now, the number one thing that you should do to practice is to practice outdoors if you must practice. If you can't practice outdoors, and we've taught this training as a live webinar a few times, and we've polled our students, are you able to practice outdoors? We're recording this almost in March of 2021. Most people can't practice outdoors right now. And even if they're in a warmer climate where they could practice outdoors, they don't have outdoor space available to practice. That would be best practices, where you would have plenty of air ventilation. the airborne contaminant of COVID-19, that virus that's exhaled into the air, it's diluted when you have plenty of air ventilation. If you cannot ventilate by working outside, plentiful air, then you can open your doors and windows. Hopefully you can do this while providing privacy to your client. Now, if you're working in a closed treatment room space, and most of you are probably working in a room that's about the size of a 10 by 10 foot room. That's very small to be sealed in a very small room with somebody who could be possibly infected. That means the air could possibly have contaminant, and with prolonged exposure, that's one of the ways you're going to acquire COVID-19. So if you can, it doesn't even matter to me if you open the door to the hallway. That's better air ventilation than staying sealed in a private treatment room. If you're in a salon or open workspace, try and not work in the corner. Move your chair to any open doors or windows and try and work in an area where you can have the greatest amount of air circling around you. When you have all this air ventilation around you, that's diluting the amount of particle that's in the air, the amount of contaminant that's in the air. And the reason I discuss this with being in ventilation, this is from the EPA, and they said, and this came out probably back in July, before we wrote the Massage magazine, and we also wrote for American Spa and the Les Nouvelles article on improving air quality, and it comes from these EPA articles. They wrote, evidence now confirms that this virus can remain airborne for longer times and further distances than originally thought. And that's very concerning for us because we know that you are in tight treatment room spaces and small workspaces. And if you are in a space, a small space with contaminated air, that's likely going to increase your risk of acquisition. In addition to opening doors or windows, we want you to improve your air filtration and your airflow. And when I'm speaking about your airflow, what I would like you to do is take the client's head, if you can open a window or door, and put the client's head closest to that opening. So when they're exhaling, hopefully that exhalation of air and airborne contaminant that's exhaling out of their airway will be diluted with any air ventilation that's coming through your open door or window. In addition to that, placing their head closest to that opening where there will be a greater amount of ventilation, we then want you to get a fan. And we want you to put a fan in back of the client's airway where that air will actually blow past the client's airway out the door or out the window. And that is a wonderful way to try and protect yourself by getting away from that airborne contaminant and allowing that virus to blow out the door. Now, it's not a 100% cure, and it's doubtful that it will blow all virus out the door, but it will improve your air quality to try and make sure that you have a greater amount of air ventilation with outdoor airspace. And in these articles from the EPA and so forth, in here in the ventilation article, it says EPA recommends increasing ventilation with outdoor air and air filtration as important components of a larger strategy that includes social distancing. And we have social distancing service appointment suggestions for you later to wear cloth face coverings and disinfection practices and so forth. We have another article here about ventilation as well. And they're saying in another different article, they said proper ventilation with outside air can help reduce the concentration of airborne contaminants, including viruses, indoors. By itself, it's not going to work, but there's a number of things you can do to help reduce your risk. And opening the doors and windows, if you cannot practice outside, even how'd you get into the treatment room? I know there's a door there. Open the door and allow that greater amount of air ventilation to occur into your treatment room. That is going to help you and that will reduce your risk. Now, I live in beautiful, sunny South Beach, Miami, Florida. I live in paradise. And when I open my door, what happens is the wind blows into the unit. That's fine somewhat, but what we don't want is we want you to watch your airflow. Do not allow the air to blow into the doorway, past the client's airway and onto you. That would be detrimental. Do not allow that to happen. Make sure, however you set up your table and wherever the air direction or airflow direction is going, you want to try and set it up where the exhaled air from the client's airway is exiting the treatment room and not falling onto you. So again, airflow is very important. Watch what happens. You can feel the breeze if it's coming onto you. If the breeze is coming onto you, you just want to make sure your client's airway is not between you and that source of the breeze, okay? Be careful you do not, I'll say it one more time, be careful you do not allow your air ventilation to blow past the client's airway and onto you, okay? Another way that you can improve your air quality is through air filtration. And one of the things that they're recommending with the EPA to improve your air filtration, if you're working in an office building, one of the things that you're going to do is you're going to keep your HVAC unit running at all times. Okay, that's very important. Also, one of the things that you're going to do is perhaps invest in a HEPA filter. I have a HEPA filter here, and it's a high efficiency particulate filter. And this high efficiency particulate filter actually has UVC technology in it, which I'm going to discuss with you in just a moment. In this EPA article, it literally says, consider using portable air cleaners. That's what a HEPA filter is, to supplement increased HVAC system ventilation and filtration is uh, especially in areas where adequate ventilation is difficult to achieve. You want to make sure you direct the airflow so that the air is not, again, directly blowing from one person to another. Make sure when you add your HEPA filters, when you're trying to clean the air, filter the air of airborne contaminant, let's try and make sure that you don't want to blow the air out of this past a client's airway and onto you. And you do want to try and clean the air. It's called air filtration, and it's achievable through a high efficiency particulate filter, the HEPA filter. Now, the reason why I mentioned the UVC technology with this, for those of you like nail technicians or cosmetologists that are using UV sanitizers at work already, I don't know if you know this or not, but there's ultraviolet technology in some of these HEPA filters. Not all of them have it. You have to look for a HEPA filter with UVC or ultraviolet technology. I actually purchased this one from Walmart for $100. And we've had these HEPA filters at the school since I opened it. I don't know why more people do not know about this UVC technology. It's actually proven to kill coronavirus. Now, the study that was done that shows that this UVC in the HEPA filter in air filtration kills coronavirus was done by Columbia University. This is not some third world study that's questionable. And I have the article right here that shows far UVC light safely kills airborne viruses. And in the article down here, now there's many different types of coronaviruses. Most of them cause the common cold. And when they studied this UVC technology on coronaviruses, COVID-19 was after they did the study. The study was done before 2019. What they found, based on their results, is they estimated that continuous exposure to far UVC light, which is in this HEPA filter, killed 90% of airborne viruses in about 8 minutes. It killed 95% of airborne virus in about 11 minutes, and 99% of airborne virus was killed in 16 minutes. 99.9% of airborne virus was killed in 25 minutes. So, to improve your air quality at work, work outdoors if you can. If you can't work outdoors and you must work indoors, work in the largest space possible. When I say work in the largest space, try and find the largest treatment room. You want to have the largest amount of air possible. Okay, so you want the greatest amount of air with the least amount of contaminant possible. When you open your door or window, hopefully that's going to increase the ventilation. So it'll be more diluted air contaminant in the air. And then you can use things like a HEPA filter to help filter the air of airborne contaminant. In addition to using your HEPA filter, you can position your HEPA filter to blow air out of the treatment room if you're indoors by positioning it in back of the client's airway and positioning the client's head next to the door and allowing that airflow to go out the door. And that is a wonderful way to improve your air quality in your session room, wherever you're working on your clients. And we have this all reviewed in Massage Magazine. And if you want to look up the article, it's called Air Quality in the Massage Session Room, three key factors. And this is publicly available. We want you to improve your air ventilation. We want you to filter the air. And there's a section here on avoiding the client's airway, which I'm going to go through with you in a few minutes. Just looking at my notes here, and I want to make sure I get everything. There is an agency that goes beyond the EPA. They have a lot of resources. It's ASHRAE. I call them ASHRAE, ASHRAE.org. And if you look here, they have guide to the COVID-19 pages, core recommendations for reducing airborne infectious aerosol exposure. There's a lot of information here on COVID-19 response and their air quality control specialist. What you can literally do if you own the establishment that you're practicing in is you can hire an air quality specialist and they can come in to your establishment and look and see if they can upgrade your HVAC unit. You want to keep your HVAC unit running at all times. Make sure that the air filters in your HVAC unit are replaced frequently. And there are air filters that literally say they're advertised that they filter for airborne virus and bacteria and mold and dust. You want to get the highest quality, highest grade air filter you can for your HVAC unit during the pandemic. It's very, very important. Now, coming back to the 5 different ways that we want to improve our safety at work during COVID-19. One of the ways we just reviewed improving your air quality. The next thing that I'm going to review with you is dedensification practices. Now, we just had the Super Bowl actually just about a month ago, and the stadium was capable of holding about 70,000 people, but they only had about 20,000 people in the stadium. That's dedensification practice. Also, restaurants are reopened, but many of them that are doing indoor dining are only operating at 50% capacity. That's dedensification practices. We need your massage establishments, spas, salons, and so forth to operate with dedensification practices to improve your safety at work during the pandemic. One of the ways that you can dedensify is by expanding your work hours. Many of us do work on weekends. That's when our clients are most available for their appointments. And if you only are open on Saturdays, and Saturday would likely be your busiest day if you're not open Saturday and Sunday, consider splitting your weekend hours between Saturday and Sunday to try and take your busiest day and cut that volume in half by booking clients over those 2 days instead of just one weekend day. You can also work longer hours at night or earlier hours in the morning and split shifts. Instead of having everyone in the spa or establishment from 10 a.m. to 6 p.m. or something like this, maybe open at 8 a.m. and have a shift working from 8 a.m. to 3 p.m. and a second shift from 3 p.m. to 9 p.m. If you can be the only person in the establishment, even better. That's dedensification. You want the least amount of people in an area to reduce the amount of airborne contaminant. And we have another article here from the EPA that says, in general, the greater number of people in an indoor environment, the greater need for the ventilation with outdoor air. So in other words, the ventilation rate should be based on the number of people that occupy an indoor space. And they say that indoor spaces are more risky than outdoor space because you can't people are closer together and there's less ventilation. So in addition to improving your air quality, you want to dedensify your practice. You want to find ways where you can work in the largest areas possible with the smallest amount of people possible. And if you're the only one in the office, you've expanded the hours. Maybe you're the only one there on Sundays now. If the reception area is your largest area in the spa or establishment and there's no one else there, work in the reception area. If you can keep it private, your goal is to, again, have the greatest amount of air with the least amount of people. And that's practicing dedensification, and it's also reducing the amount of contaminant in the air. Now, the next thing that I want to discuss is reducing your exposure at work. This is included in the Spa 101 article. If you want more air quality tips, we do have these repeated in an American Spa magazine article, just so you know. And we have some reducing your exposure practices that we want to review with you. We just did the first, improving your air quality, the second, dedensification, and now the third safety protocol that we want to go review with you to protect yourself and others against COVID-19 the best that you can without self-isolating is just to simply reduce your exposure. Now, one of the ways that you can reduce your exposure at work is to practice socially distant services. And Esthetician Edit published a really lovely article that we wrote, a kind of fun article about how to provide socially distant services. Now, it might sound a little weird or awkward, but just stick with me for a minute because it actually makes sense. Your goal in socially distant services is to keep your client prone the entire time. For me, when I'm providing service these days, and I mostly even though I'm a triple licensed, I'm a massage therapist, an esthetician, and a nail technician. They call us triple threats, right? Even though I'm a triple threat, I mostly practice just massage, and I'm a full-time teacher and educator. When I do my personal massage appointments, I have all of my clients in prone position these days. And they're wearing face masks in addition to the prone position. I'm practicing outdoors and I have my HEPA UVC filter with me outdoors. And I have the HEPA filter behind the client's airway. So it's actually blowing air past the client's airway and away from me. And when I'm doing my massage service in the prone position outdoors, I actually stand at the client's waist, similar to you seeing this picture in the body scrub right here. And I'm trying to stay the furthest away from the client's airway. And that's how we're reducing exposure. One of the ways, there's many different ways to reduce your exposure. And we review that in the Les Nouvelles Spa 101 article. And you can find this article at Les Nouvelles, lne.online.com, Spa Safety 101. And in here, we talk about many different ways to reduce your exposure. How you position your client is one of the ways of reducing your exposure. If you're a hairdresser or you're providing chair massage, stand behind the client's airway. Don't stand in front of the client's airway while providing that service. That actually puts you at risk. And if you're a hairdryer, you've got the best tool of all. You've got something called a hairdryer. And you can use that hairdryer, stand behind the client, and direct your hairdryer in a manner where you can actually blow any exhaled contaminant from the client away from you. What a nice tool. I wish as a massage therapist or esthetician I could walk around with a hairdryer and just keep that air blowing away from my own airway. So when I'm inhaling, hopefully it's a little less contaminated from whatever's going in the air here. So to reduce exposure, many different things you can do. With a socially distant service, one of the best things to work on is the client's feet in prone position. As long as you're working on an adult client, you're almost 6 feet away from the client's airway when they're face down and you're on the opposite side of the table and you're standing up while they're lying down. That's almost 6 feet distance, which is great because they want us 6 feet away from people. It should be more than that, and it should be, for a minimal amount of time. Another way you can reduce your exposure is obviously doing shorter appointments. The CDC tells us treat everyone as if they are infected. And the only way our safety precautions can be effective is if you treat everyone as if they are infected, whether they appear to be healthy or not. There's a lot of asymptomatic people out there who they don't have any symptoms. You would never know that they're colonizing and shedding this virus and infecting everyone they come in contact with. So be very careful. Socially distant services are a wonderful way that you can try and stay away from the airway and reduce your exposure. Also, do it yourself services. If somebody has a gift certificate and they want to use it, okay, they've waited a year, they're sick of waiting. It's, been a pandemic. They're mentally fatigued, they've been self-isolating, it's their birthday, and they're going to come in and use their gift certificate. They're going to take the risk of exposing themselves to a stranger in a small enclosed environment. While you're doing this training, to practice outdoors if you can. Open your doors and windows, get the air filtration and airflow going, and then if they don't care what service they have with a gift certificate, they just want any service to pamper themselves for their birthday or why ever they're making their appointment, suggest doing a foot service. You can do and do it yourself services. So with a foot service, you can have them sit alone in a room in a foot soak. Give them a lovely aromatherapy soak and allow them to sit there and with relaxation music. Now, usually with a do-it-yourself service, you might provide water or chocolates or snacks with fruit and nuts and so forth. We don't recommend doing any of that during the pandemic. I'm sorry, there's no more tea time. No more refreshments. What happens when people consume their refreshments? They remove their facial covering. So we're not providing refreshments in the spa or establishment environments anymore. If you want to give them a bottle of water after their service, fine. They need to consume the bottle of water outside of the establishment. With your exposure, you also want to make sure everybody's wearing their face masks at all time. That's why we're not doing the refreshments. And when they come into the establishment, they should also wash their hands. That would be great practices. Some people might be a little offended by it. You can also give them hand sanitizer to sanitize their hands. But I'd rather have somebody offended while at the same time letting everyone know you take safety precautions very seriously and you're working very hard to minimize their risk and your risk of acquiring or transmitting this deadly virus. Now, with your do-it-yourself services, you can have them sit in a foot soak, and then if you know foot reflexology, you can provide foot reflexology in the prone position. You can also do a foot facial with having them sit in the foot soak. That's going to help cleanse their feet. You can do another cleanse on their feet and remove with hot towels. You can do a foot scrub, remove with more hot towels. You can do a body scrub in the prone position too. If you're operating in a dry treatment room, try to use sugar or salt scrubs, okay? These will dissolve with water. So all you need to do is you're going to apply your scrub, you'll scrub the area, and we have a picture of your scrub right here in the aesthetic social distancing. This is actually in a wet room. But if you are working with scrub, use salt or sugar-based scrubs, and all you need to do is rinse your hands with water and then scrub some more. And it can be just a bowl of water. If you're in a dry treatment room, you won't have running water. Get a large bowl of water, rinse your hands with water, scrub some more. Rinse your hands with water, scrub some more, and continue this process. Eventually, that salt or sugar will dissolve with all of that water. And then you can simply use hot towels to remove the remaining residue of that scrub. And after you do that, whether you're doing a full body treatment or just the feet, preferably the feet, that's the most social distance you can get from the client's airway, you can then apply in a foot facial, maybe a foot mask. There's plenty of them out there, nice clay masks to soften the feet. You can wrap those in hot towels or dry towels. You can do compressions through the towels, remove the mask, and then you can do a foot massage. It's a lovely service, and it really minimizes your exposure to the client's airway. And we call those socially distant services. Also, doing things like body scrubs are a wonderful social distance service. You can do an aromatherapy shower with a body scrub. So you're going to scrub them fully prone in prone position. To do the front of the legs, you can simply scoop under the leg. Just be very careful you're not using something that's terribly abrasive with really sharp crystals when you're using your sugar or salt scrubs. There are different scrubs that have a greater or lesser amount of granule in them. And if you're going to scoop underneath the legs, make sure it's not sharp and scratchy and feels like it's cutting them. But you can try and do the full body scrub in the prone position. Never work above the client's waist. Just reach from their waist up and around their shoulders. You should be able to reach. And then when you're working the legs and the feet, you're further away from the airway. That's a wonderful way to reduce your exposure to them. And then give them some aromatherapy shower gel and have them go take an aromatherapy shower by themselves. They're still having spa time. They're still getting pampered, but you're removing the practitioner from the service in those do-it-yourself services. And when you remove the practitioner, you're reducing your exposure. Now, spa is the Latin word for water. So if you're working in a spa environment, water therapies are perfectly acceptable. And water therapies are usually done without the practitioner. So great social distance services or any type of water therapy where the client can enjoy sauna, steam, a whirlpool, a shower, a foot soak. And then if you're going to do a bodywork service, provide it in the face down position and work on the backside. Now, and reach underneath to get to the anterior side of the body. Now, I'm just going to check my notes here, make sure we got everything. And I think we do on this one. We have another page of exposure to review. If you are doing your services in a socially distant manner, it's very important that people keep their face masks on. And you keep on hearing me tell you to work in the prone position. That means no facial massage and no intraoral service for those of you who do cranial sacral therapy or neuromuscular therapy intraorally. It was all over the news recently how a plastic surgeon in Florida died after doing lip injections on somebody who was infected with COVID-19. The woman was perfectly asymptomatic. She didn't appear to be ill, but a few days later, she started having symptoms and she got tested and she was positive. So she called and told the physician that she coughed or sneezed on or something like that. It was in the news. And the physician actually was COVID-19 positive and he died. Now, it's not necessary to have lip injections during this pandemic and expose yourself. And the same with facial waxing or facial service or intraoral work. I mean, if the client can't live without it, it's your choice to put yourself at that risk, but it's not recommended during the pandemic. So we tell everyone, if you must work, try to avoid facial service or intraoral services. Many of you have licenses with scopes of practice that will allow you to do alternative services just like this in the prone position where you can stay away from that client's airway. And that's what we're trying to do. We're trying to keep you away from their airway to reduce your exposure to it. And then we're even working with the client's airway of using HEPA filters and fans to blow any exhaled airborne contaminant out of the treatment room. To reduce your exposure, we also want you to remove any unnecessary or unused items in your treatment area. Anything that could become a contaminated surface but was unnecessary for the client shouldn't be there. It's just additional risk. So let's reduce your exposure by removing things you no longer need. In your reception area, you should no longer have things like magazines or papers. They're porous. They could actually have virus in them and contaminant in them. So we're asking you to throw all of the disposable items, and you don't want your clients sitting in your treatment room and in your reception area contaminating your air either. So throwing those types of things away is good practice. We want your clients filling out their intake forms at home over the computer, over some type of secure internet service, whether it's a secure email or a secure website. If you have any health intake forms that they need to fill out, let's try and have these filled out at home and submitted to the spa. And if you are going to do a health intake form, I'm going to review with you a massage magazine. They have a free massage intake form that screens out COVID-19. I think you enter your name and email address to get this free download. But in this intake form, it's really important. It's asking questions such as, do you have a new cough? Do you have a fever? And if there's any questions that they are saying, yes, I have these symptoms, you know better than to allow them to come into the establishment and have a service. You don't want anyone who's showing symptoms of COVID-19 in your establishment infecting your workspace air, even if you have an N95 mask and so forth. We don't need this contaminant anywhere around the treatment room where you could possibly pick it up yourself or with touching the surface and then maybe rubbing your own eye. And we don't want the next client in being exposed to a contaminated surface or any airborne virus, because we do think that this COVID-19 is aerosoled. It's lingering, as I showed in the EPA article, longer than they originally thought. So just keep these people who are symptomatic at home, no service for you. Call me in 10 days when you've no longer had any of this, 10 days after these symptoms have ended at minimum. A negative COVID test would actually be even better. The nice thing that I like in this free COVID-19 intake form, and I understand many different liability insurance companies are providing these to uh, their insured clients. I use a Massage Magazine one. This is the only one I've used, and it has something in it called informed consent. And boy, do I love this. In the informed consent of this intake form, which I downloaded mine like last early fall, so I don't know what it's like now, 6 months later. Hopefully it's the same. The informed consent literally says something like, you are aware that there is a current pandemic of COVID-19, which is an airborne, life-threatening illness, virus, and it can cause severe illness or death. And I understand I'm receiving this service that I could acquire the COVID-19 virus, and or I could be transmitting it. And it literally says, I accept all risk, including serious illness or death, in receiving today's service. Now, that's informed consent. That's telling the client that they are at risk when receiving the service of serious impact, and then they sign it. Yes, I'm aware of this risk and I still want my service. And I like the extra protection and the peace of mind of knowing that my client has thoroughly been told and knows that if I was possibly asymptomatic or if somebody else was asymptomatic in my space and they have acquired this virus in my space, unfortunately, maybe your space could be a super spreader area where there was a massive amount of contaminant and too many people there. You didn't practice dedensification. It's nice to have these intake forms that say that they accepted the risk. And then practice all these other things with air ventilation, air filtration, open the doors and windows if you can, get HEPA filters, use UVC technology if you can. All of these can help reduce your risk. Hopefully you'll never have any type of exposure at the spa where multiple people could be exposed. I do want to go back to the UVC technology for one real quick second, because I forgot to tell you guys about something that's really important. Now, I don't know why everybody doesn't know about UVC technology. I think we should all have this. But one of the reasons why it's probably not more popular is because we know that ultraviolet light can be harmful to humans. And that's one of the reasons why it says far UVC light. So if you stare into ultraviolet light, you can actually damage your eyes. And if you have ultraviolet light up against the skin for prolonged periods of time, that could damage your skin. And so far UVC light, when it's encased in your HEPA filter and you're not sitting, 2 inches from the ultraviolet light itself, the far UVC light across the room blowing away from you, I think this is the way to use far UVC light. Now, there are some people with ultraviolet light, when it's used in a HEPA filter, it creates some type of ozone, that it's actually bothersome to the throat, and they might get a sore throat with that HEPA filter running with the UVC. I know that it has been irritating my throat, and it's been doing it since day one. And people who are asthmatic might have an irritated throat with this. I would much rather have an irritated throat than COVID-19. Even if you're young or healthy and you're confident you would live through COVID-19, you're not, 90 years old and at high risk, you don't want COVID-19. There's something called long hauler effects. And we don't know really what this virus is going to do to people 5, 10 years from now, if there's going to be more organ damage than what they're already finding. So, lovely, you survived COVID, you didn't have any symptoms, it was no problem. Well, not so easy, because again, there's possible long hauler effects that could be damaging for you later on down the road. Also, you might live through COVID-19, but one of your clients or one of your loved ones at home might not. So you would never want to transmit this deadly virus to others. It'd be probably pretty hard to live with that. So do whatever you can to avoid the acquisition or transmission of COVID-19, and whatever it takes. That includes reducing your exposure. So we just reviewed informed consent and a client health intake form to screen out COVID-19, and have your clients fill out these forms from home if possible. Consult an attorney or someone about your legal operations and obligations with your clients. We're not here to teach you that, but we are here to give you best practices on how to minimize your risk from this virus at work. Another thing you can install is a no jewelry policy. People do not need to wear necklaces and bracelets and rings and so forth to receive your service, okay? And when they remove these to receive your service at work, it's possible that they could lose these when they're putting them back on. What happens when people are removing jewelry and putting it back on at work? There's more contaminated surfaces if there's virus on the jewelry wherever they place it. In addition to that, and possibly losing it, they're spending more time at your establishment. The goal is actually to get the client in and out of the establishment as quickly as possible. That reduces your exposure. One of the ways you can do that as well is have the client wait in their car or outdoors before their appointment. There's no more sitting in the reception area enjoying a nice, relaxing spa time before they go in for their service. Every minute that that client is in your treatment area or your reception area, they're contaminating the air with anything they're exhaling from their airway. Now, most of the time, it's just harmless bacteria and virus that we exhale. But right now, we have a deadly virus that's colonizing in the nasopharyngeal passage, and we definitely do not want any potentially infected person in your establishment for longer than need be. So have them, there's no more jewelry, and that's a great policy to have at your establishment anyway. No jewelry policy at work. Reduces the amount of time they're at work, and that also increases the amount of time you can spend sanitizing the treatment space when they're in it for less period of time. That'll give you greater amount of time to work with it before the next client comes in. My dad even waits outside for his hairdressing appointment up in Vermont. It's freezing up there right now, but he waits in his car. Cars have heaters, and he's a very grouchy 70 something person, but he understands that we want to practice dedensification. There's no need to have a greater amount of people indoors than what's necessary. Please, if you're in like let's say they took public transportation, it's freezing outside, please let your client indoors. Don't make your client an elderly woman waiting in 90-degree heat outdoors who again took public transportation. Don't make them wait outdoors and dedensify in that way. As long as you can safely dedensify, people have safe areas to wait prior to the service. That's what you want to do. You want to think about it as protecting your air. Okay. So keep people out of your space by dedensifying as much as possible. All right. We're going to move on. Let me make sure that I've got our dedensification and reducing our exposure. One of the ways you can reduce your exposure, this just came out last week from when we're recording this. And this new study shows that wearing 2 masks properly is better than wearing 1 mask. So to reduce your exposure, you can also wear 2 masks. Now, I know some people hate wearing masks. Sorry. Our goal is to give you best practices. That's what this training is about. And best practices is actually for both you and whoever you're interacting with to wear 2 masks. If you want to make a policy of 2 of you wearing 2 masks, this study shows an amazing statistic. It says the receiver's exposure was maximally reduced by greater than 95% when the source and receiver were fitted with modified medical procedure masks. To do this, you would actually have something like your, what do you call it? It's those surgical cloth, they're blue with the ear loops. You're going to take that medical mask, the surgical mask, and you're going to make sure it's nice and fit and snug. And they usually have those metal bands. You're going to make sure it's nice and snug around your nose and it's fitting to your face. Okay. We don't want the mask down on the lips. In your nasal passage, you can colonize and shed the virus from your nasal passage. So the mask needs to be over your nose and your mouth. And then they're recommending things like nylon coverings to go over those surgical medical masks. And if you're wearing these 2 masks properly, again, there's a chance that between you and whoever else, if you're both doing this, you can reduce your exposure by greater than 95%. That's phenomenal. Now let's talk about sanitation. We've already been through, out of our 5 steps, how to improve your air quality, how to practice dedensification, how to reduce your exposure. And our 4th step is to increase our sanitation. Now, most of you are providing 50-minute services in an enclosed treatment room, and you do your 50-minute services on the hour every hour. That's not enough time to practice sanitation, folks. I'm going to give you a couple reasons why. One of the reasons is for contact time. And let me review. There's 3 very important terms that I want to discuss with you when it comes to sanitation. Those 3 terms are cleaning, disinfecting, and sanitizing itself. So when it comes to sanitation practices, and we know that we've all increased our sanitation practices, we should have always been practicing great sanitation, as if COVID already existed prior to this whole outbreak, this whole new pandemic, the 2019 pandemic. Because any infected surface, any surface that has bacteria, virus, and so forth, there's transference. When you touch it and then touch your own eyes or nose or mouth, any type of mucous membrane that can absorb these germs, we can possibly infect ourselves. That's why we have the common cold, we have flu. We're just infecting ourselves with other germs other than the coronavirus, known as COVID-19. So our sanitation should be 100% at all time because nobody wants a cold or flu either. Let's discuss these 3 terms for sanitizing to make sure we're all on the same page and improving our practices. There's cleaning. Cleaning physically removes germs and dirt and impurities by washing them away with soap and water. You're going to physically wash and remove debris and with a sponge or whatever you need, and then you're going to remove and rinse. You can either rinse it in a faucet or you can use wet paper towels or wet towels, whatever, that can be launderable, and you're going to rinse these and dispose or launder whatever you're rinsing with. That's cleaning. Soap, water, rinse. Okay. Disinfecting for spa and bodywork and massage and cosmetology practices. Disinfecting usually uses chemicals to kill germs. Okay. So a surface or object has a chemical such as a wipe or a disinfectant spray or something, applied, and it sits there for a certain amount of contact time, which I'm going to review in a minute. And then sanitizing is simply lowering the amount of germs that cause disease or cause illness, okay? So let's make sure we're on board with those three terms before we go through all of this. I want to review contact time in those 50-minute hours when we're practicing on the hour every hour, because in order for your sanitizing to be effective, to lower the number of germs, disease-causing germs from a surface or object, you must always clean the area first and physically remove any dirt or debris. And then after an area or surface or object is cleaned, then you disinfect it. That is proper sanitation practice. You clean and then disinfect. You need to do both. Disinfection does not work through debris, organic debris, dirt, and so forth. If you have it covered with food, mold, whatever, what have you, the disinfection process is just not going to be effective. It's not going to kill anything. So disinfection has to be on a clean surface, and then you need to employ something called contact time. Contact time is also known as dwell time. It's the amount of time that the surface or object must remain wet with disinfectant. And I'll give you some examples. These Clorox wipes, these must be any surface or object that you're disinfecting must remain wet with this Clorox white solution for 4 minutes. I wrote 4 minutes on it. I read these before the presentation to kill that 99.9% of virus and bacteria. Disinfectants are literally pesticides. They kill virus, parasites, and so forth. They're registered pesticides with the EPA. And I did a course. It was a pre-recorded course. It was offered, I think, by the CDC or something about sanitation practices. And I'll never forget what one of the physicians said. He said, always on the disinfectants, read the label. The label is the law. These disinfectants had to be registered with the Environmental Protection Agency to be able to advertise that they kill 99.9% of virus and bacteria. But you must follow the label in order to achieve that efficacy. Now, what happens with most massage therapists, spa, and salon workers is they might disinfect something, but they won't leave it on for the full amount of contact time. These Lysol wipes, these disinfectant wipes, take 10 minutes for a surface to remain wet for the 99.9% advertised benefit to be effective, okay? I worked at the Miami Cancer Institute as a volunteer, and I worked in the chemotherapy infusion suites. And one of my jobs was to disinfect the chemotherapy chairs. And let me tell you, you don't want to come into contact with chemotherapy. It kills things like cancer. It's very toxic. And we came up with a protocol that it took 7 Cavicide wipes to keep the chair saturated with chemical disinfectant, Cavicide, for 4 minutes. And that was the protocol. So if you're disinfecting your table, you might want to take and find out how much contact time your disinfectant uses, and then wipe your table, and then watch the table and how long it takes to dry. If it's this Lysol wipe that takes 10 minutes to dry and it's dry after 5 minutes, reapply the disinfectant. I don't think it matters if you have to keep on reapplying to keep it wet. It doesn't have to be the original application for the entire contact time, as long as that area remains wet with the disinfectant. That is the goal. And you should get it right with the first application, but if you don't, definitely keep on reapplying and establish that whole contact time. Now, if you're working on 50-minute hours and you're trying to disinfect and it's a 10-minute contact time, how are you going to achieve that 99.9% efficacy of killing germs if you got to spend the whole 10 minutes with contact time? And the client had to dress and undress in that 10 minutes. Now you know why we have a no jewelry policy. I have some more disinfectants here, and these are aerosol sprays. This one has to disinfect for 10 minutes, okay? So it's similar to the Lysol wipe. Anything that you spray must remain wet for 10 minutes. And they say they have further directions. Remember, the labels of the law, these had to be registered with EPA and show efficacy, prove efficacy to advertise this. And they say, spray 6 inches away and let it remain wet for 10 minutes. Now, this disinfectant spray, this one's interesting. Let me see if I can get it in the camera. I know my picture's probably really small, but it says it disinfects in 20 seconds. Oh my goodness, I can't imagine the chemical in this that kills 99.9% of germs in 20 seconds. That must be very effective, although I haven't looked this up to make sure it is EPA registered. Sometimes, it's a pandemic and the sanitation supplies out there are very short in supply, right? And one of the reasons why we're not employing proper contact time is because we just can't get disinfectants. You're probably shocked I have all these disinfectants. I sometimes every time I go out of the house, I stop at the stores and I try and scoop up any disinfectants I can get. Because once we open the school, we want to make sure we don't have a super spreader event and we keep everything sanitized. So with your treatment room, and your treatment area, just make sure you're disinfecting properly with contact time. You can use things like bleach soaks. Bleach is pretty available today, now in 2021. So if you can soak objects in a bleach soak, there'll be contact time for that. Hand sanitizer. We don't necessarily use contact time language with hand sanitizer, but due to the appalling shortage that we've had in hand sanitizer, we're going to talk about it, and we included it in the Massage Magazine article. And that is, we want you to sanitize your hands with hand sanitizer. They should remain wet for 20 seconds with hand sanitizer. And even better if you use friction for that 20 seconds. That friction helps kill germs and eliminate germs. What's happening with a shortage of hand sanitizer, people taking a little pea size of hand sanitizer and their hands never even become fully immersed or wet with sanitizer, and that's not sanitizing your hands. Your hands are still full of virus and germs and so forth. So make sure if you're using sanitizer, they're thoroughly wet, and think about contact time. You want them to stay wet for at least 20 seconds. And it's better if you can wash your hands. If you're going to wash your hands, we actually have a blog at CE Institute. And you can come here to ceinstitute.com, click on our blog, and then we have select category here, and you can come to COVID-19 to see all of our recent articles. And in July of last year, we put up some of the CDC guidelines, and we were already teaching sanitation for the cosmetology industry. So we just copied this off from our current cosmetology course of all the CDC recommendations on how to properly sanitize your hands. So hand sanitation is just as important as surface sanitation in your treatment room. You want to make sure you're keeping everything sanitized. Let me just review my notes here. We do have several articles that are published about sanitation. One was the Massage Magazine of your contact time. If you're unfamiliar with contact time, this is still up with Massage Magazine. You can Google it. We have another article with American Spa Magazine on sanitation and how to properly sanitize at work in a spa environment. Now, the next thing that I want to talk to you about is how to sanitize your table at work for those of you who are using your tables. Now, if you're using a chair, you can apply these same sanitation practices to your chair as well. I have 2 articles that I wrote which were published by 2 different magazines. This is for the spa trade, the Les Nouvelles Aesthetics and Spa, did treatment table sanitation, and Massage Magazine did 7 steps for proper massage therapy table sanitation during COVID-19, which I'm going to review with you right now. This is going above and beyond your normal sanitation practices during COVID-19 to sanitize your table. When you're sanitizing your table, you're going to strip, and during the pandemic, you shouldn't have table skirts on, and even heated fleeces and so forth. If you're leaving a client in the prone position the entire time and they're breathing down into the table, into the cotton fabric of whatever's covering the table. I don't recommend leaving that there because again, if they're shedding virus and highly contagious and their viral load is large, we don't need that virus all over anything in our treatment room. So it'd be nice if you just took those and set those aside and didn't use them during the pandemic, the table skirts or the fleece blankets and so forth. When you're sanitizing your workspace, by the way, you need to make sure you're gloved up and leave your masks on. Okay. Sanitation actually can create injuries to your airway and to your skin. So we have a Sanitation 101 article on our blog here. And if you are on CE Institute, going to our blog, click the category COVID-19. This is the Sanitation and Chemical Hazards and Safety 101 for Massage Therapy Practice Spa and Salon that's coming up on our blog. We have many different COVID-19 articles in our COVID-19 blog that I'll try and review with you real quickly. These are common cleaners and they're known side effects. And some of these, they can trigger asthma and allergies. They may be hazardous to humans. Some chemicals cleaners that have formaldehyde cause cancer. There's other carcinogens and so forth. So you want to be careful when you're sanitizing to use proper precautions to protect yourself so you don't have a workplace injury during sanitizing. All right. So protect yourself, strip the table of anything unnecessary before you're even using it or sanitizing, and just keep that in the closet. And then make sure whatever linens you're using at work launder correctly. Most laundry machines have a sanitized setting if they're newer. Use the sanitized setting. If you can use bleach with your laundry, use bleach. That's a great disinfectant. And also use the highest temperature heat possible you can when washing or drying any laundry if you do the laundry at work. Using heat kills germs. And we have a 101 on germs in our COVID-19 blog, the 101 on germs, what massage therapists and personal care service providers need to know about it. And we review the 4 different types of germs and how bodily fluid germs are spread. Virus is one of the 4 main categories of germs. So using high heat can help sanitize your laundry. If your laundry is damp, it likely, when it's coming out of the dryer, it likely did not have high enough heat to dry it. And any type of damp laundry could be harboring virus or bacteria, so and other germs. So make sure you're using high heat and your laundry is thoroughly dried. And that's one of the ways you can remove germs from your laundry. When you clean your table, you always want to wash first with soap and water, rinse, and then you can disinfect. Remember when you're disinfecting your table to use proper contact time. And also, if you are using a table and you're keeping your client in prone position to reduce your exposure, which is A-OK, good job on that, you might want to consider using 2 different face cradles. Okay, when you use 2 different face cradles and face cushions and so forth, and I'm showing you a picture of them right here. Then you don't have to, I mean, the one area that's going to be exposed to the most amount of germ is a face cradle in a treatment table when the client's lying in prone position. So if you're using 2 different ones, I'm talking the whole face cradle and the face cushion, you can wash it, disinfect it, and then sit it in the corner of the room and let that disinfectant really work on it even longer than the prescribed contact time, and use a new face cradle. And, if you alternate face cradles between clients, I think that's a more effective way to sanitize than trying to clean and disinfect your face cradle in between clients, especially if you're working those 50-minute hours. Sometimes there's just not enough contact time for the disinfectant to really work. So that's one of the sanitation practices that we're recommending with your COVID safety tips at the workplace during the pandemic. Now, we had 5 categories that we addressed with you in the beginning. We were improving air quality, practicing dedensification, reducing your exposure, increasing your sanitation, and the last thing is your general practices. In your general practices, we want you to treat your practice a little bit different. It might be a little bit more expensive, but let me show how you can pass along the cost. We have an article here we wrote for Massage Magazine, and it's how to sanitize your massage stones. But you can use these practices of what I'm recommending here towards anything. Hairdressers, what's your tool? Your hairbrushes and so forth. If you're thinking about aesthetics or cosmetology and even massage, any type of body brushes or loofahs and so forth. All of these objects are tools of our workplace, and many of them, if they're not disposable and they're reused from client to client, some of them you cannot sanitize, properly sanitize in between clients. They might be porous, okay? So, what we're asking for the practitioners to do in your general practices is consider doing things like passing along the cost of whatever tool you're using to the client to help keep them safe. And they might appreciate having their own product or their own tool that's used only on them. That might make them feel safer as a general business practice in your establishment. They might come back to you. That might be a retainment to come back to you because they know that hairbrush is only used on them or those stones are only used on them. And in this article, not only did I tell everyone how to properly sanitize stones, even when there isn't a pandemic. But I went a step further. And what I did is with nail technicians, when you're using your nail nippers and your nail clippers and your nail pushers, sometimes clients have their own nail nippers and they're put in a Ziploc bag and you write their client's name on them. And every time the client comes in, that's their tools. You only use it on that client. And what I recommended with hot stone massage is you could do the same thing with hot stones. You could do the same thing with a body brush. You can do the same thing with your hairbrush. Whatever you're using on your client, service after service after service, this works for your regular clients, you're going to purchase that tool just for them. You know, you can get hairbrushes, somewhat quality hairbrushes for 5 to 10 bucks, okay? I mean, obviously the better ones cost more, but it's a pandemic. Pass along the cost. Listen, can you throw an extra 5 bucks? I want you to have your own hairbrush. 10 bucks, I want you to have your own hairbrush. When it comes to stones, the stones that are placed over the sheets, your placement stones, those don't come in contact with the client. But if somebody's a little bit skeevish, like, ooh, I don't want you massaging me with the same stones the last client had. What if they're infected, even though you sanitize them? No problem. I have extra working stones, palm stones. We only use about 6 to 8 palm stones in a treatment anyway, maybe 12, but you can purchase 6 to 8 stones. They'll only cost about $20 or $30. And you can say, no problem, I can get you your own stones. I'm going to put them in a Ziploc bag. They'll have your name on them. These stones that are touching your bare skin and I'm massaging you with them for the whole hour, those will be only used on you. Same thing with body brushes. First of all, you should never not even when it's not a pandemic, do not reuse body brushes from one client to another. That's just filthy. But if you were, ask clients, maybe you start out your routine of whatever you're doing on them with a body brush first. Fine. Body brushes you can get for a little as $1. Hey, I'm going to tack on an extra dollar for your charge. This is your own body brush. Give it to them to take home. It's a nice service, or just keep it at the spa and they know that's their body brush and you're not using it from one person to the next. Okay, so I've pretty much reviewed all of the articles that we've had published, and I again want to go one more time at ceinstitute.com. We do have this blog, and then under the category here, you're just going to click COVID-19, and this is where we're putting a lot of the articles that have been published and also any information new we have to post and share with you guys during the pandemic. We want to make sure that everybody's safe and for you to thrive once the pandemic is over, especially once the pandemic is over. Because we feel that after the pandemic ends and after this self isolation period is over, people will be rushing to your tables and chairs wanting some pampering. We've all been through a really rough time, and it'll be nice to have some of that personal care once this is all done. Now, We usually teach CE credit for CE hours at CE Institute. They're live interactive webinars. We have many different subjects, and we hope you come to our school and support us. That's one of the ways in one of our regular live interactive webinars. They're $99 for 12 hours right now. They're a fantastic deal, and we'd love to see you in one of those. For those, we don't have CE credit for this course, but if you want to show that you've actually attended it, for a small fee, and my handouts, excuse me, they're all marked up, but we have step by step by step of everything I just discussed written down for you. And you can actually log in at the bottom of this YouTube video. There's a link. You can click on that. It's $19.95, and you can get our entire handout, as well as we put the resources in here too in one convenient place. Or you can just watch the YouTube over and over and over and take your own notes, and you can look at the websites we're at and look these up yourself. I know that Les Nouvelles might charge a small fee for some of my sanitation articles. And right here, we have them all written for you in one place, and you can get those for that fee. We also have a certificate. So if you want to, show your attendance for the course, if you want to show that you've actually gone the extra step and trained, we have a 5-question test that after you pay your $19.95, you'll be able to download your handouts. You can take a very simple 5-question test. As long as you paid attention during the presentation, you should pass it, no problem. If you don't, you pass your test immediately. You can take your test over and over again until you pass it, or until 48 hours passes. We give you 2 days after you log in and pay for your access to download these materials, take your 5-question test, and then it allows you to download and print your CE certificate. It looks something like this. And you can show to your employer, you can show to your clients that you've really taken the safety and you've taken this seriously, your safety and their safety, to protect yourselves during COVID-19. We unfortunately do need to charge for it. Our software company that stores the downloads that you can print out with a handout here. It's 10 pages right now. And to execute the testing and get your name on that certificate, they charge us every time we add a user. And then there's only so many users for a certain period of time we have. So that's why we give you 2 days to do. It takes 15 minutes to do this. So within 2 days, you should be able to complete your process, and then your access will expire. So we hope you enjoyed the course. That's all we have to share for you right now. You can come back and check back with us on our blog for new updates of any new information we should share with you during the pandemic. We're trying to keep this updated as quickly as possible. And again, we are teaching live interactive hands-on webinars right now. We will have live in-person class resumed again. We'll probably start with all vaccinated population first, students and teachers. And then once it's safe, once we have the herd immunity, or however we're going to proceed, we will have our live in-person classes at some point. So again, my name is Selena Belisle. I'm the founder of CE Institute. This was the COVID safety tip training for massage, body workers, spas, salon, personal care providers, and practitioners. The only way to keep yourself safe from COVID-19, to avoid the acquisition and transmission of COVID-19, is to stay home and self-isolate. But if you do work, we do hope that you are able to follow some of these tips and that they do keep you safe. Thank you very much for watching, and we hope to see you again in one of our other trainings. Bye-bye.